askReddit by Mr. GreatStory. Welcome to another Reddit Stories video. Today we have Reddit Doctor Stories. If you enjoy it, be sure to subscribe for daily updates. Doctors of Reddit, what's the biggest case of faking it you've ever seen? My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and she'd squint at home and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses, but the doctor was a little concerned because the tests indicated she needed really thick glasses, and usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision and her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she'd need some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all, and started to cry. She got grounded for a while. I had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "hello wave." She started to throw her arm up too, but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. Young, 18 to 20, woman went running into small rural hospital pretending to have abdominal pain. The police officer had tagged her going 40+ km over the limit, which was "stunt driving" as per the new law in Ontario. Impound and license suspension automatic. The cop followed her into and apparently said he'd be waiting for her when she left. Locum staff such as myself were housed at a small B&B about 15 minutes away, and the had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents/family before I booted her. Except BHCG came back positive and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something are up when he hears air ambulance calls coming over the radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a WTF moment. Edit. Well, this blew up overnight. I got a few messages. A little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Reminds me of an old post where some hobo came to the hospital speaking incoherently, and they decided to give him a checkup anyway to show to the students it was a university hospital, and he turned up to have some issue with the liver. After they treated him, he became lucid and turns out he was a professor on his way to a lecture when his liver stopped functioning properly and he couldn't think clearly because of that, so he was just wandering the streets for a while. Taking trauma call during surgery residency. Had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT scans and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with youre, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week with no improvement. Always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. The patient last was seen sprinting down the road, naked butt cheeks flapping in the breeze. He made it to a city 4 hours away by car before he was caught again. I have never seen anyone fake it so well. Truly playing the long con. Dermatologist here. The patient was convinced she had melanoma and needed a biopsy and would need to be on workers' comp. I told her it looked like ink from a marker. She demanded a biopsy. I wiped the area off with an alcohol swab and showed her the ink and that there was no spot on her skin anymore. She stormed out threatening to sue. I'm just glad I cured her melanoma. Had a patient come in for a fall who now couldn't move their legs at all. Did a bunch of tests, didn't find anything. The patient was not at all fazed by suddenly being paralyzed, which was the first red flag. I didn't really believe anything was wrong, but the patient was still not moving their legs. My options are to admit for a huge workup or get them to walk. So I update them saying everything is fine, tests are negative, you can go home. The patient gets up, gets dressed, and walks out without a word. We had a patient faking a seizure, so my supervisor told one of us to get the brain needle. The patient made a miraculous and swift recovery without intervention. That's the best part about most of these stories, when they make up some form of the fake machine, so that the patient stops faking. Cracks me up every time. Physical therapist here. The working mom comes into the clinic with her infant in a stroller. She's limping like she's got a nail in her foot. Wincing in pain and tears in her eyes. She's crying during her visit with the PT. None of us think she's faking it. She limped out of the clinic. I glanced out of the window and saw this woman bounding down the sidewalk. Hips swaying, full stride, going places. We were all fools. My brother was an EMT for 2 years, and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego because the hospital is in Oswego by faking seizures. Sometimes when the head EMT guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures, but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. We had a family calling for a medical, a cab paid for by income-based insurance, from somewhere out in the sticks to our in a college town. Every few weeks or so, the mom would be seen for some ailment or the other, and the rest of the family would go to Walmart, go to the mall, do all their in-town errands. She was basically faking an emergency illness every few weeks, so they wouldn't have to pay for a cab to get their shopping done. Sorta along with the same idea, working at a pharmacy we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. This patient comes in for back pain with a weakness of the legs. Gets a full workup with MRI, standard blood work, and then some immunological things to look for stuff like myasthenia gravis. No neurological or immunological explanation for the weakness. The patient is seen by physical therapy and they are of the opinion that the patient is holding back intentionally. Go to see the patient at the end of the day and prep them for discharge. The patient is infuriated that they are being discharged, yelling and screaming about how they aren't better, how they are disappointed in the institution, blah blah blah. They said one particular thing that still clearly stands out 3 to 4 years later. "I can't believe you're sending me home already. I haven't even told my family I'm here, and now you're going to send me home, before they even have the chance to see me." My attending and I leave the room to arrange things with the nurses. We go back in, and the patient is out of bed and standing up in the middle of the room. Miraculously the patient is able to walk with zero assistance when they had so much difficulty with any assistance over the previous 2 days. At that point, they were enraged. We went into the room without knocking. They were discharged home after a conversation regarding abusive medical services. Was the patient's goal to have their family see them in the hospital? I could see that. A couple of my more socially isolated Facebook friends tend to post hospital selfies with captions like "interesting night" because they need some attention and haven't learned healthy ways to get it. The tearful family visit could be a big deal if what the patient really needs is a hug. Nurse for an ophthalmologist here. Had a 21-year-old new patient claiming to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. He would feel around while walking, tried to keep eyes rolled back into his head. The whole 9 yards. He said he is a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. He took my phone out of my hand and effortlessly found the YouTube app and typed away in the search bar. Oh, and of course his eyes were back to normal and focused. Continue to watch. The best is still to come. One time my roommate, who is an IQ nurse, came to see one of my indoor soccer games. During the game, a player on the other team went down hurt and started screaming in pain and swearing and rolling around while holding his ankle before he was eventually helped off the field. He then limped over to where the fans sat and watched the rest of the game brooding in silence before he left early. After the game, my roommate told me he was going to go over and see if there was anything he could do to help until he saw that the guy was limping on the wrong leg. I once saw a patient who had been faking paralysis of the legs for years, used a wheelchair, never walked, etc. Old records showed extensive imaging, neurology consults, and other tests that proved the patient had full function of all extremities. Family/friends were just going along with it, not sure if it was really a conversion disorder or if the patient had some secondary gain issue. Not a doctor, but I'm a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did come back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room, and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to the hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so I thought it best to add and edit. This patient was not by any means a benefits seeker. They were a hardworking and loving family that had full-time jobs. She had been booked in to have her tubes tied, but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy and became very mentally unwell. She did not realize the implications or understand the fact that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts, she is doing very well now. Also thank you very much for the slivers. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the tonopin, a device you poke them directly into the eye with, and they go what the fuck is that thing? Obligatory, not a doctor, I'm a nurse. We had a guy who had to come in every 3 months to get a medical certificate to say he couldn't work at his retail job due to severe disabling back pain. He was receiving large amounts of insurance money for this condition. After the doctor had done his usual examination and questions and signed it off, the guy asks the doctor to check his shoulder, which doc does, and asks how he injured it. Guy says playing rugby for a competitive team. Really, says doc. How long have you been playing for them? Guy has been playing and training the whole time. Doc puts this info on an insurance form. Doc loses his shit in the staff room laughing. Next week the patient loses his shit in reception because his insurance has been cancelled. Guy came to her. I was a nurse at the time. For stomachache when asking him about history he randomly mentions a fight with his girlfriend, where she left in a tizzy and he fell asleep on the couch 20 minutes later. When we see the court, he has a satellite cable remote wrapped in a condom lodged in his rectum. I suppose he intended to frame her. Didn't get to hear the conversation he had with the doctor. I was curious about how he was going to explain why she was nice enough to wrap it in the condom. I'm a nurse, but not a doctor. I had a patient who worked in a hospital, janitor, so he knew enough to fake a bit. He was seeking pain meds, complaining of chest pain, wanting morphine. He was worked up for everything cardiac and was fine. Then he tried to claim GI discomfort when he was being discharged. Cleared again for everything. Faked chest pain again. Cleared again. Now he's my patient. I'm a new face. He's telling me he's having abdominal pain. I call the doctor, knowing this guy's history. He says he'll be up to see him soon. This patient wants a ginger ale, some stomachache. I decide to go to lunch. My coworker comes into the lunchroom, disgusted. This guy had taken a dump in a basin and then dumped the ginger ale over it and tried to tell her he'd had fecal vomiting. He obviously needed Dilaudid right now for the pain. I walked into his room and sure enough, a pile of shit in a puddle of ginger ale. I told him I'd have to take away his food and drinks and we'd have to put an NG down. Suddenly he changed his tune. He admitted to faking it. Why do these people do what they do? In the story, opioids. A nurse bringing a patient back to a room who said he had kidney stones. I had him stop at the bathroom and get a urine sample. Dude comes out with a specimen cup that literally has a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual I've crippled paraphernalia, crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call, but had to take a backstreets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in the clinic with her I've crippled jet up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. What did you do at that point? We need part 2 of this story. I could not have sworn, under oath, that I had absolutely positively identified the woman power walking. I know it was her. I later confirmed she lived in that area. She and her attorney could have argued that it was her sister or daughter or cousin, or whatever. So I just honestly answered all the questions during the deposition. I could not answer because I did not see her immediately after the accident. I could, however, honestly say that I thought she had a good prognosis and was likely to recover fully. BTW, it is not unusual for patients seeking compensation through some legal process to exaggerate the degree of their injuries. Everybody involved in the process understands this. It is, however, incumbent upon the patient to maintain their act in a believable fashion. 4th year medical student. On my rotation and trauma came in from a woman that had been arrested. During the drive, the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor, didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay, though some of the nurses said that they caught her peeking at us when they would leave the room. We ended up getting a CORD scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids, and held them open while telling her to wake up. Finally, she started fighting to close her eyes and the jig was up. The doctor called her out, and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Not a doctor but a nurse. I once read a specialist's consultation report, and at the end of the report the actual diagnosis given was fictitious ailment. There's actually a psychiatric diagnosis of factitious disorder, factitious with an backquota, which is a faked illness for primary gain. That is, the patient likes being in the sick role. This is contrasted with malingering, which is for secondary gain, like missing school/work, insurance fraud, lawsuit settlements, etc. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat, as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. When I was a kid I learned I could fake sick and get out of school. So 1 to 2 days a week I would get a migraine and hold my head and complain, and I would get to go home. Eventually, my parents took me to a neurologist who said, maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. I grew up the opposite way. I would get 3 to 4 migraines a week, but everyone thought I was faking it because most days I seemed fine, just because I was learning how to deal with them and try to act normal. It wasn't until 8 years after they started that I went to a neurologist who said I have chronic migraines, which I dealt with unmedicated for 16 years. Now I'm on medication. I feel like my childhood was wasted. My mom's a nurse, and she said once some crazy lady came in and complained that she had whooping cough, and whenever she coughed she followed it with a loud woohoo. 30-year-old woman came to the ED with such excruciating belly pain. Paralyzed. Oh god, it hurts. When you press there. Must have oxycodone now. A doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the edition. Not a doctor, but a nurse once had a patient having a seizure. The other a nurse, and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously, looked straight at him, and yelled, "Shut up, fat boy." He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for a few months after that. At least she wasn't having a seizure. I'm an IQ and a nurse. We get a lot of malingering in the ear. One day, one of our frequent flyers came in and started faking a seizure in Tridge. Now obviously I know this lady and she's fake seized a million times before. But this time it's in the lobby in front of about 30 people who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself, and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Edit. No, her name wasn't actually Karen. I just did that for confidentiality. I'm not a doctor but a nurse. There was a geriatric patient taking advantage of the call bell because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like "please lift the blanket up for me," or "please pass me my phone," or "please feed me," and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no, and that she needs to start doing things for herself, she grew more and more frustrated. Eventually, she snapped, grabbed me by my collar, shook me aggressively, and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. 1 upvote equals 1 prayer for old lady's arthritis. I'm a doctor. I used to tell stories about things like this, but lately, I've come to realize that many people who are faking it have a severe psychological trauma. For instance, child sexual abuse, which is manifesting in physical symptoms or some other bad cause for their factitious disorder. Even for the malingerers too, they're usually in a terrible place in life despite how much fun it is to read about their stories. We should treat both types of people with compassion and understand the circumstances that brought them to that place in life. I totally had a patient who nearly killed herself injecting her own poop into her skin though. That was pretty wild. Thank you for watching. Tell me which one was your favorite. Like, subscribe and hit that notification bell for more. The next video will be even more interesting. You are a legend.